From your PHLV radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening. Welcome to Healthy Mondays with the AAPINA of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor at Roseman University College of Nursing. Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa at patuloy na pagtangkilik sa aming mga episodes. And I know that everybody's trying to be safe and healthy, especially this holiday season. And our topic tonight is very timely, and it is related to our experiences, not only my experience as a person, as a faculty, as a nurse, but also experience directly from our nursing students and how they are coping with this COVID-19 global pandemic. Before I introduce our special guest tonight, I wanted to share to you with some statistics that I gathered. This is not updated. This is as of December 4th, 2020. Didn't get the chance to look up the statistics for today. The Southern Nevada Health District in the state of Nevada, Department of Health and Human Services, reported cases in Nevada. The overnight cases is 3,194. The statewide cases is 165,628. Test positivity rate is 20.6%. And the statewide deaths is 2,301, and the statewide hospitalization is 1,729. Even though we have a lot of hospitals, acute hospitals in Nevada, we still need to be cognizant about the capacity of each our facility. So without further ado, I wanted to introduce our special guest tonight, our very own Dr. Kay Fontanilla. She's our current treasurer for the AAPINA of Nevada. She's also a faculty at College of Southern Nevada. Welcome, Dr. Fontanilla.
Good evening, Dr. Armstrong and Kays. I'm glad to be here tonight to share some insights about, how we're dealing with the pandemic.
Thank you. And Kays, welcome to Healthy Mondays. Do you want to say a few words?
Good evening, everyone. I'm the president of AAPINA, which is the student chapter of the AAPINA of Nevada at Roseman University. And I'm very glad to be able to share my experience as a student and how COVID has affected my education and my clinical experience as well.
Welcome to Healthy Mondays, and thank you both of you. It's a last-minute request for them to be interviewed for our broadcast tonight. And I wanted to give a shout out to Kays Quito. She's doing very well and doing an excellent job as our president for AAPINA Roseman University SNA. And so I wanted her to start sharing about her current role as the president of AAPINA RUSNA and how is her role important in addressing the challenges of the COVID-19 global pandemic locally, nationally, and internationally? Go ahead, Kays.
So as the president, I typically oversee all the activities that we offer to the students. So before COVID, we used to always participate in health fairs, and we would always go out there and just like regular participation and volunteer work in the community. But as COVID cases rose, our community service was greatly impaired to the point that we can't really go out there because we respect the CDC guidelines and also the university's guidelines. So as president, I gathered my executive board, and we were vigilant and looking for ways on how we can still offer community volunteer, or like how to help the community, but also maintaining social distancing, and also abiding by the stay-at-home ordinance. So when the pandemic hit, most of the Asian countries were greatly affected. Like, they were the ones who were actually suffering the most when it hit in March. So I reconnected with some of my friends who were also heading organizations in the Philippines, and we inquired like, how can we help in there, like, because the families are suffering. Unlike America, Philippines doesn't have the budget, and just they're not equipped for the pandemic. So we came up with an idea of providing families with a specific care package. So it basically included like rice, canned goods, like something that could sustain a family for a week. And we call that project the 200 PHP care package. And as an organization, we were able to pull enough money to feed over 100 families in the Philippines. So that's our initial action in helping the Asian American Pacific Islander community. And then afterwards, we were more focused on local, because if students are not able to work, they're not able to actually get money for themselves to buy them like food, and their comfort while studying will be like deeply affected. So like I talked to Dr. A about it and my executive board, and we decided to establish the nursing student food pantry over at Roseman University. So how it is like, it's exclusive access to free snacks while they are in campus, regardless if they are part of the organization or not. And so far, since it's been established in July, it's been thriving, and we've received very positive feedbacks from the student body, and they said that it actually helps them while they're studying, because they don't have to worry about going out there looking for food. They could just stay in the university and actually have access to food. And then
Sorry,
also
I also wanted
we all
to interrupt a little bit because I wanted to give a shout out to Case, because as their faculty advisor, there's so minimal supervision, and this is the idea that they come up with. And I think it came up with the need, the desire and the passion to help others. And I'm really very proud of your group, because you thought of internationally, and then you brought yourself back locally and right in front of your eyes, and who you can help right now in front of you. And I think that this is a good example for our listeners out there to see and look around, and how can you help as an individual help the other people around you cope with this global pandemic. And I'm very proud of Case and her officers, because they were requested by our dean to put together a policy and procedure before they can set up, and before they were given the cabinets to store the snacks and the drinks and whatever that the students can have. And they had put up that policy and procedure, and it was approved by our administrative council. So kudos to you and your officers for doing that. So that's your local initiative. I think I want to go back to Dr. Kay Fontanilla to also share what the our other SNA group from the CSN, and Dr. Kay Fontanilla is the faculty advisor for the APINA CSN SNA.
Hi, and yes, I'd like to thank Dr. Armstrong and Kays as well for assisting our president, our SNA president for the College of Southern Nevada, in forming that group and guiding them with with the many endeavors that they are planning to do. So our organization looks up to the ROSNA, since you are the original SNA, and we're doing so much already in terms of helping the students cope with the pandemic. However, initially, when this pandemic happened, the SNA has already been formed, and somehow we wanted to find ways to serve the community locally, maybe nationally and internationally as well. I know we've done some, like, contributing or giving some financial support to international endeavors, such as the one that Case was talking about. I know we contributed to that as well. My role, my true role is, to help also these students, because they are in this organization where one of their goals is to serve the community. And with the pandemic, it is very challenging and difficult. So I would say my role was, how is it important is, I think I helped foster achieving the organizational goal of the SNA by having our president, Jamie, touch base with Dr. Armstrong, with Case, so they can join in those community services. And one big community service that they served and worked with Rosna and Dr. Armstrong, and I was there too in more than one occasion, is volunteering with distributing food items and assisting in facilitating the flu vaccination, which is conducted, I think, by Walgreens, right? Is that correct?
Well, it is a partnership with our first community partner, along with PHLB Radio. The Asian Community Development Council actually reached out to me. They called me and they said, can you help us put together a free drive-through, free flu shot, as well as apparently Caesar's Palace had donated 1,000, a total of 1,000 frozen family meals to the community here in Southern Nevada. And so that was a great opportunity. So we gathered our thoughts together, and we were told that we cannot call it a drive-up clinic or drive-through clinic, because the CDC requires for us to monitor the individuals who had gotten the flu shots at least 15 minutes before we let them drive out. So it was changed to drive up, free flu clinic and food distribution. So there you go. We always try to follow the rules and regulations, for our safety and for everyone's safety. And with that, we thought of providing and CSN nursing students and Roseman nursing students have helped with distributing snacks. So while they're waiting for the 15 minutes up before they were allowed to drive out after getting the shot, they were given bottled water and some snacks like chips and cookies of what they would like, and then they drive through and getting the frozen foods. So there you go, our listeners out there. There's so many ways that you can help others in the community. Even though we are stay home, there's still opportunities as long as you follow the regulation. I guess we'll go into the second question that I had shared with both of you. Case probably could tell us, what are the identified challenges in the teaching and learning, I guess in your case, and teaching the patients in the community and learning and your perspective in these challenges, how they are being addressed?
So initially, there are a lot of people who were like saying that COVID is not as bad. It's just another type of flu. And like, it's very, coming from a healthcare standpoint, it's very hard to like educate those people. Like, it's not as simple as like flu because we don't have a vaccine for COVID. And there were also people who were like, oh, just clean it with like Clorox wipes or anything. And it, as a person from a healthcare standpoint, I was like, that was challenging to talk to people who were not open-minded about what's going on in the environment. And then as a student, I'm used to going to the classroom and actually participating in class. That's my optimal way of learning. And I think the biggest challenge for me was staying at home doing virtual learning instead of actually going out there and experiencing real clinical rotations. I feel like due to the pandemic, our batch of nursing students are deeply affected because there are skills that we actually were not able to practice in the hospital. And I feel that when we graduate and come out there, apply for jobs, it will be extra challenging looking for jobs because they know that we're not well equipped or we're not yet well trained to deal with patients. But hopefully for the senior practicum, we get to practice. But as of now, states are closing again. So I'm not sure, but we're very optimistic about that.
Well, I can tell you that some of the clinicals are still on site because as I mentioned earlier, I was just at another facility last week, and I'm going to another facility tomorrow. I think it's a matter of the facility trying to accommodate the learning of our students, and I think that if in case the senior practicum is not going to be in the facility, I think that the facility hiring personnel will take into consideration the challenges that our nursing students are facing now. In reality, when you start working in the facility, you will be put on a training. So that training, and then hopefully they're going to extend that training knowing that some of the students did not really have a hands-on practicing their nursing skills. So I wanted to thank you for your insights, Case. I want to go back to Dr. Kay Fontanilla about what about on your end of the world in the academia? What are your identified challenges in the teaching and learning?
Of course. Yeah, of course, there are many. Well, I would also want to support, Kay's worries. I know it's worrisome, not, or it's bothersome, not having the needed skills that you should have been learning in a clinical site. It's totally different when you are in when we transition to the online modality where it's not actual, it's not reality when you are not appreciating the patient's presentation and stuff like that. But as what Dr. Armstrong mentioned, hospitals will take it into consideration, what is lacking, because this time it's reality. You didn't get the chance because of the situation, and there is shortage in nursing, so there will be a need for you guys. So going back to the question, what are the challenges? There definitely are challenges, as we all know. This COVID-19 pandemic impacted not only the frontline staff and clinical leaders, it has also impacted or caused issues to colleges and schools. And as what Case mentioned, it has impacted their learning. Like students' clinical and lab experiences were disrupted and had to transition to online. Not only that the students had a difficulty, taking that, the preparation for instructors, we were facing, like we were so busy and very challenged in, okay, what are online activities that will truly help these students. And at the same time, we incorporated COVID. That way, they know how to handle things in a situation like a pandemic or an epidemic. So the college has had a lot of plans and implementations that they came up with to help the students, not only with their learning, but with their health issues. We're making sure that we are educating our students to avoid getting the disease, spreading the disease when they are in the campus, because in the middle of this pandemic, we started getting the students to go back to the campus to hold their lab, and we have to follow guidelines, making sure in a big laboratory, maximum of 10 people, including the instructor, and so on and so forth. However, challenges are coming up again because of the surge of cases again. So we don't know again what's going to be this coming spring 2021 semester.
Yeah, thank you for your insight. That's the fear of the unknown. And I also wanted to, I only want to speak to, I echo the challenges on the faculty as well. We hear the challenges that Case is sharing about on the student side. When I also got thrown into teaching the senior prac virtually. I was worried about it because I wasn't sure if we were going to be able to deliver as much as we can and make it as real as possible with the case scenarios that we have. Fortunately, the platform that our university uses is the one of the best platform that we can use, and so that the case scenarios are almost true to life, and it truly identified opportunities for critical thinking and clinical decision making, where it gives you a case scenario, and then it asks you what you would do. So I think that it's very important for the faculty to minimize the challenges and fears of the student that they're not going to be prepared when they start looking for a job. And the feedback from the students who were in the middle of that virtual is that they felt that the debriefing, I think the most important thing is the debriefing. After the case scenario, then you ask the students, how did you feel about this case scenario, and how did you feel being challenged on what you need to do? Even though they are, cartoons or, the virtual characters that you have. So I think there's another question here. As a community member, what are your challenges in taking care of yourself and others? I think this is more personal now. So we're kind of transitioning from the academic side to our personal side, our families. For me, I'm so worried that my family will get it, especially last Thursday, my first ever to go back in the facility. How about you, Case? Have your group had done any on-site, or I guess we can talk about when we did the community outreach during the free drive-up clinic. What were your thoughts then?
I think on the drive-up flu clinic, we did really well. Delegation of work was good, and everyone was abiding by ACDC's guidelines, and everyone was really participating, and they wanted to contribute. At the same time, the people who were driving up to get the flu shot were also maintaining social distancing, I guess, and they were all wearing masks, which is really good. Personally, I always get worried when I need to go out to get groceries, or when I need to go to the campus to refill the food pantry, because the people that I interact with, I'm not sure where they went or what other people they have interacted with. And especially when I go home, my parents are in the age group which are at risk. So there's always that doubt and worry whenever I come out of the house. But as extra precaution, we always do hand washing, masks when we go out, and as much as possible, we don't entertain like visitors, and we just minimize like social interaction in person. If anything could be done online, or if we just talk over it over the phone, that's preferred. And also, I feel like this pandemic, the most challenge that I had was like taking care of my mental health, because those case studies that we were doing in exchange of the in-person clinicals, they were really like lengthy, and you have to go in depth. And as students, we had to work on them like all day, because we're not allowed to work as a group. So there were times that during clinical days, I would not be able to do my normal routine, or I won't be able to cook, or like priority is school over, But so I feel like this pandemic, my mental health suffered a little bit, because I don't get to do the stuff that I usually do to relieve my stress. But as the months went by, I guess we have developed a defense mechanism. Like, we have our own personal defense mechanism and coping mechanism. So I'm just glad that like I'm doing really well now, and I don't worry as much anymore, knowing that we're doing our best to prevent ourselves from getting COVID.
That's great. That's great insights. And everybody has to kind of modify their activities. I still wake up 5 o'clock in the morning, but now I like the comfort of if I'm hungry, I can just walk over there in the kitchen, or if I wanted to cook some dish that I want, then I can just easily whip up something while I'm listening into the lecturing or whatnot. So there are some positive things that's coming out of this pandemic. So how about you, Dr. Fontanilla? As a community member, what are your challenges in taking care of yourself and your family and others?
Yeah, well, very similar to what Case has mentioned and what you have mentioned. Because of the hectic schedule with our jobs and profession, we tend to forget to care for ourselves, which of course will potentially cause health issues. The beginning of the pandemic, very difficult because of there are many alternative strategies that we have to create, to still be able to facilitate student learning. So it was really very, very difficult for me. So that's one of the stresses. Another stress is, I have a mom who lives with me, and she's in her late 60s, and I still have to go out and buy stuff from the grocery and then come back home. Although I've availed of those delivery services, which sometimes is very difficult because you don't really get what you need. Like, it's not available. That stresses me out, being worried about my mom, potentially getting the virus, or even my family members, because I have my children here with us also. I worry about my children because, when they're in college, they participate in college activities, in university activities. My children are not just members of sororities or organizations in their schools, but they are, like my older one is a president of a sorority, but right now her monthly meeting is just online and no activities are being held. And I feel for her, and I feel like they're becoming isolated, and I don't see them being depressed because somehow we talk to them, considering the silver lining of this pandemic being being with their family more than ever, more than before, because now they're like just here at home, and we get to know each other. So that to me is the silver lining of this of this pandemic or COVID-19. Although it's not something to be happy about because of what this COVID-19 has caused to others. Did this come close to home? Yes, I have close friends. My husband has an aunt who passed away. So that is why all these stresses, this isolation and depression thing has caused us heaviness in our hearts. However, as what Case has said, other things that we can do are, other platforms we can use is to still be able to network and connect with others and share our knowledge and help them avoid all these things, all these circumstances that we can acquire from the pandemic, such as feeling down, not caring for ourselves, being unhealthy, is to continue to communicate with others, with our loved ones, and let them know of provide them with information, correct information. You yourself, ethically, because you are in the healthcare field, should follow recommendations so that they will follow you as well. Avoid spread, I think.
And that's so true. Our well-being, and Case mentioned about our mental well-being. And I think especially for Filipinos, we were born to mingle. We were born to socialize. And here we are told to stay home and not have any of our family visit us. That is depressing it in itself. Mm-hmm. So I think that our listeners out there are so many other ways, because we're so blessed that we have this advanced technology that we can still reach out. When they say social distancing, it's really physical distancing, not meaning that you can't socialize. You can still socialize through virtual. We had a virtual bingo, family bingo during Thanksgiving. I celebrated my birthday previously, and then everybody just had the virtual greetings. So that is something that our listeners out there, especially this holidays, you can have a Christmas party through, and then and you can have your family internationally to join. So there's a lot of good things that's coming out of this global pandemic. Also, I wanted to slip this in that our AAPINA of Nevada is going to have a virtual pandemic party, Christmas party, and it's going to be in December 19th. I believe it's 6 p.m. to 8 p.m. And so if you'd like to join us, we have posted it on our Facebook page, Asian American Pacific Islander Nurse Association of Nevada, and we have prizes. We have a jewelry store jeweler who had donated some prizes like diamond ring, bracelet, what else? So please join us. It's a raffle ticket. Yeah. So I also wanted to do a shout out to our very own President-elect, Dr. Ray Sarapica, for finishing his psych mental health nurse practitioner program. I am so jealous because I'm also supposed to be in that program and I kind of chicken out. I have other things that I need to do, but here you are, Dr. Ray Sarapica. Congratulations. We are so proud of you. Your AAPINA of Nevada family are very proud of you for your completion. I know you're studying hard right now. You're supposed to be here being interviewed, but first things first, he's reviewing for his board exam. So I wanted to do a shout out to you. So I think we have one last question. What can we do? And we actually touch upon it already. What can we do as a community during these holidays in regards to mind, body, and spirit in the midst of the global pandemic? And I kind of touch upon like virtual bingo, virtual party. So, Case, we're going back to you. Any insights about it?
So I guess in order for us to be able to take care of ourselves amidst the pandemic, it's very important to establish a modified daily routine and also incorporate to it, like, if you used to go to the gym and you're scared to like go to the gym now, you could do like meditation at home, or you can even do yoga, and you could watch like YouTube videos and copy what they're doing. It's You're gonna have fun and it's safe because you're in your own home. And there are also like churches that conduct their masses and services virtually. So like if you're part of like a congregation, you can look them up and see if they're providing those services, because that would really help in preventing further spread of the pandemic.
The good thing about this is even our elderly now are getting to be savvy with technology. I think it's a good thing. At first it's very scary because of the fear of the unknown. And it's always scary to make changes in your daily routine. But now that we're slowly getting used to it, I think it's getting easier and easier. But nevertheless, mental well-being is still a concern, because not everybody is as resilient as we are, and not everybody is able to have effective coping mechanism that they can use. So, Dr. Kay Fontanilla, do you want to add anything else about holidays in regard to mind, body, and spirit? And
well, very thankful of the benefits of technology, because we are able to attend webinars, and we have members and leaders of the community that conducted and shared their expertise in centering and mindfulness, which many of our members have attended and are able to apply in their daily lives. Actually, aside from the holiday fundemic, what we call it, fundemic party that's going to be held on December 19, AAPINA CSN has been having once a month webinar. They're meeting with their members, and they have speakers every meeting, to help out those students with their daily, what they can apply in their daily practices, such as how to get a mentor, which our own Flora Saison was one of our speakers just recently. We had Dr. Borines, who spoke regarding centeredness and mindfulness. In the month of October, I believe one of our male professors talked about, how is it being an Asian or a Filipino and a nurse as well, being in practice, and how is he coping, as a nurse. And that was during the Filipino Heritage Month. And some TED Talks that they share. So there are a lot of community sharing that is happening in that organization, which I believe, and feedback that I got is, it helps the students, with their daily dealings in life, not just as students, but as as a member of their family or their households.
Yeah, and wow, great feedback to our community and listeners out there. So you see, there's a lot of things that you can do and still keep safe. Physical distancing doesn't mean no socialization. So you still can socialize, through the technology like Facebook video chat. I just video chatted with my classmates from the Philippines and checking how they are. So you can still reach out, globally with our advanced technology. So I think we're running out of time. Time flies when we're having fun. That's my cue. So thank you so much, Case and Dr. Kay Fontanilla, for your willingness to share with our listeners out there some insights about what your role is in this global pandemic. And so, listeners out there, I challenge you to think about what is your role? What is your role in keeping everyone safe? I think stay home if you don't have to go anywhere. So, again, thank you for listening to our Healthy Mondays with AAPINA of Nevada. Thanks again to our special guests tonight, Case and Dr. Kay Fontanilla. Of course, our community partner, PHLV Radio, for always supporting us. And I think that for the next Monday, I'm hoping that we can bring in the rest of our founding members and our incoming officers to share their insights. It's always good to hear other people's insight because it brings in what you can do and that you never thought about that you can do in this global pandemic. So once again, thank you everyone for listening to us. And remember, every Monday is Healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.
From your PHLV radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio.